Eye cancer, also known as ocular cancer, refers to the development of malignant tumors within the eye or its associated structures. Although relatively rare, eye cancer can affect people of all ages. In this comprehensive guide, we will explore what eye cancer is, the standard treatment options available, its seriousness compared to other cancers, the prognosis at different stages, promising therapeutics in the FDA approval process, the unique challenges it presents, FDA-approved medications for eye cancer, risk factors for its development, and a list of organizations and resources that provide support for those undergoing eye cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. What is eye cancer? Eye cancer encompasses a group of malignancies that can originate within different parts of the eye. The most common types of eye cancer include retinoblastoma, a rare pediatric cancer that starts in the retina, the tissue at the back of the eye responsible for vision. Intraocular melanoma, a cancer that forms in the cells that produce pigment in the eye. It typically occurs in adults. Primary intraocular lymphoma, a type of lymphoma that primarily affects the eye and is often associated with central nervous system involvement. Conjunctival cancer, cancer that originates in the conjunctiva, the clear tissue covering the white part of the eye and the inside of the eyelids. Standard of care treatments for eye cancer. The choice of treatment for eye cancer depends on the type, stage, and location of the tumor, as well as the patient's overall health. Common treatment options include enucleation. In cases of severe retinoblastoma or advanced intraocular melanoma, surgical removal of the entire eye, enucleation, may be necessary. Local excision. For smaller tumors, surgical excision can be performed to remove the cancerous tissue while preserving the eye. Plaque radiotherapy. Radioactive plaques are placed on the eye's surface to deliver targeted radiation to the tumor. Proton beam. Therapy. Proton beams can precisely target the tumor, sparing surrounding healthy tissue. Intravitreal chemotherapy. Chemotherapy drugs can be injected directly into the eye to treat certain types of eye cancer. A website to look up promising clinical trials is onclive.com. The book Cancer Self-Defense 101 – Quick Tips to Help You Survive, discussions of many integrative treatments that may be of use for cancer originating in the eye. Seriousness compared to other cancers. Eye cancer is generally considered less common and less serious compared to some other types of cancer. The prognosis and seriousness of eye cancer can vary widely based on factors such as the type of cancer, stage at diagnosis, and treatment response. Some forms of eye cancer, like retinoblastoma, have a good prognosis when detected early and treated appropriately. However, advanced intraocular melanoma and primary intraocular lymphoma can be more challenging to treat and may have a less favorable outcome. Prognosis for Stage 1 eye cancer. The prognosis for Stage 1 eye cancer, regardless of the specific type, is generally more favorable. Early detection and treatment can result in a high likelihood of cure, particularly for localized tumors. The 5-year survival rates for Stage 1 eye cancers are often quite good, ranging from 80% to 95% or higher, depending on the type and specific circumstances. Prognosis for Stage 4 eye cancer. Stage 4 eye cancer indicates that the cancer has spread to distant organs or tissues beyond the eye. The prognosis for stage 4 eye cancer is less favorable, with a lower 5-year survival rate. On average, the survival rates for advanced eye cancer may be lower, often ranging from 15% to 40% or lower, depending on the specific circumstances and treatment options. Promising therapeutics for eye cancer. Research into eye cancer is ongoing, and promising therapeutics are being investigated, including targeted therapies. Investigational drugs are being developed to target specific genetic mutations or molecular pathways associated with eye cancer. Immunotherapies, immune checkpoint inhibitors and other immunotherapeutic agents are being studied for their potential to enhance the immune system's response against eye cancer cells. Why is eye cancer tricky? Eye cancer presents several unique challenges: location and anatomy. The complexity of the eye's structure can make treatment planning and surgery intricate. Early detection. Eye cancer, especially in its early stages, may not cause noticeable symptoms, leading to delayed diagnosis. Pediatric cases. Managing eye cancer in children requires specialized care and consideration of the child's growth and development. Limited treatment options. Due to the rarity of some eye cancers, there may be limited treatment options and clinical trials available. FDA-approved medications for eye cancer. FDA-approved medications for eye cancer vary depending on the specific type and stage. Treatment approaches often involve surgery, radiation therapy, chemotherapy, or a combination of these modalities. In some cases, intravitreal chemotherapy drugs may also be used. The choice of treatment is individualized based on the patient's diagnosis and medical history. Risk factors for developing eye cancer. Several factors may increase the risk of developing certain types of eye cancer. Age. Retinoblastoma is typically diagnosed in young children, while other forms of eye cancer are more common in adults. Genetic factors. Inherited genetic mutations can increase the risk of retinoblastoma and some intraocular melanomas. Exposure to ultraviolet, UV, light. Prolonged exposure to UV radiation, such as from sunlight or tanning beds, may increase the risk of conjunctival cancer. Organizations and resources for eye cancer treatment. For individuals and families affected by eye cancer, several organizations and resources offer support and information. The American Cancer Society, ACS, provides comprehensive information on various types of eye cancer, treatment options, and support services. The Retinoblastoma International offers resources and support for families dealing with retinoblastoma. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.